Hi, it's Dr. Janowski for Sonata. Today we're going to do a lip, and there's many ways to do a lip. You can use a cannula, there's many different products. I've tried just about every HA product in the lip, and you really should only use an HA product in the lip or fat. But for HA products, Restylane family, I've tried them all. They all can work to some degree. We're going to use Restylane Define today because Define is a nice firm, it's a volumizing product with some firmness, but also at the same time flexibility. It sounds contradictory, but that's the way the product works. It has a volumizing quality to it, and it does hold its shape, but it has a flex to it, which is great for a area like the lip that moves a lot. So I use what's called a micro droplet technique, and you'll see the needle's very small, it's very short. There are multiple tiny pokes, and with numbing cream patients do very well with this technique, and it gives us a lot of control. So I'll show you how that works.
Go.
So we're going to do the lip here, and if you come around this way you can see the patient's lip, and she has a nice volume already, pretty well defined, so we don't have to do a lot of shaping of the lip. We're just going to add some volume. And if we just use this very small 0.3 cc syringe, it's an insulin syringe, and then we just tap that in, a lot of the importance of this technique is really trying to reduce pain and discomfort. So if you move the tissue toward the needle, like I just did there, it hurts less than moving the needle into the tissue. So we use the left hand. It's really important to assist in tapping or moving that needle in without a lot of sensation felt by the patient. And we can use it in the mid red lip there. If we needed more definition, we could go along the border, but we don't really need a lot of border here. Her shape is very nice. We'll put a drop in the GK point, which is this point right here. Gives us a little more shape, a little bit of pout. And then when I go from the lower lip, I like to go from underneath the lip. It hurts a little bit less, there's less risk of bruising. And again, we're just placing it in the central portion of the lip, just under the mucosa. We're avoiding any important vessels there. And by using this very rapid injection technique, we can really make it quite comfortable. And the cream is quite effective and only takes about 5 minutes to work. Good, so again, we're just adding volume in the tubercles of the upper lip, which are here. And we're extending it out to the side. Some people prefer a more tapered look. Some people like to see the red lip come out to the sides. She already has a red lip there, so we're just going to follow her natural pattern because it looks good. And again, small amounts. There is lidocaine. I do mix my products 1-to-1 with saline, and add a little extra lidocaine with epinephrine, so there's a little more comfort with the treatment. And so again, we want to maintain a good proportion. Typically the bottom lip should be a little bit bigger than the top, as it already is, so we want to maintain that. People look silly or funny if they put too much in the top and not enough to match it in the bottom. And the bottom lip should have more of a taper than the top lip does. So when the top lip extends out, we see a nice taper, and that's a natural taper there. And so we're just kind of looking around and seeing, okay, where does it look good? And there's usually very little bleeding or bruising with this procedure, the way I do it. Let's see. Yeah. And in some people we will split the treatment into two because they look nice and volumized, and then we can wait for it to go down a bit because it always goes down a little bit. And they can come back and we can touch it up if they feel like they want more, so we don't have to over-inject the lip in one session. Other patients, they just want it all done at once, and that's totally fine. If we inject more towards the border of the lip, we get a little bit of eversion or flip up. And Define's a nice product because it really will smooth out, even if it looks lumpy or bumpy or feels lumpy or bumpy in the first day or two. That will just go away. So we've put almost an entire syringe in here. What do we have left there? Just 2 left. So we may not even need to do the whole thing. So this might be one of the situations we just wait because it's looking quite volumized and we want it to look natural. So I think we'll hold off there. Let's get a wet. And so you can see there's very little bleeding. There's often very little bruising, if any. And the patient can go right out. And this product does not swell very much, so most people do not complain of that following this procedure, so they can go about their business. Let's put some arnica on there. And so that's it, and it just took all 5 minutes. How was the pain level out of 10, would you say?
A 1.
A 1, yeah, so 1. With the cream, a 1 is great. Okay. So that's the, you can turn that off. So that's the lip injection with the micro-injection technique using Restylane Define. And as you can see, she has a nice natural look. We didn't use the whole syringe, but we can bring her back and we can always finish that later.